I traveled 8 hours across the Atlantic to come and see Dr. Khorasani to have their procedure done, and I'm really glad I did.
Dr. Khorasani has a calm and assuring manner. He immediately makes you feel comfortable, and of course you have confidence in him.
I've been very, very lucky because he's a very understanding, caring, empathetic man.
So welcome, I'm Dr. Khorasani. Primary goal is obviously oncologic care of skin cancers and reconstruction. We also offer many cosmetic procedures such as liposuction, both for body and extremities as well as the neck, neurotoxin injection such as Botox, filler injections such as Juvederm or Restylane, and fat transfer.
I had a quite large mold right on the side of my nose. It was unpigmented, but I had it since birth. It was a big thing in my life, actually. It sounds maybe superficial, but it made me very self-conscious.
And when she came to see me, at that time she had really lost hope. She did not think that this would be possible to do it.
Yeah, it really has changed my life in so many ways. I never really felt beautiful and comfortable with my face. I used to wear a lot more makeup than I do today, and it just, yeah, it made me feel really beautiful.
My skin was really severely sun damaged. It was blotchy, had red spots, the pigmentation was different and so forth.
Your skin looks great, it looks very smooth. A lot of the pigmentation that you had on the sides are improved.
Yes, my skin I think has a much more even tone. I think it's firmer, and all of the blotchiness and the redness went away, and I also had wrinkles, and they've been pretty much eliminated.
Close your eyes for a second. Oh, very nice. You healed beautifully. I mean,
thank you.
The other very popular are the hands. As we get older, we tend to lose a lot of fat underneath the skin. So by just injecting also some filler, one can really turn back the clock.
I came to Dr. Khorasani because I was in a car accident. I had a lot of surgery, and through the surgery and the years, I have gotten, with my face, quite old. You know, I wouldn't look like this if it wasn't for you.
You look great. Part of my job that I love the most is that I can come to work and really make these long-lasting relationships.
After all I've had in my life with this accident, it was such a wonderful feeling to look in the mirror and see a lovely lady again.
The gold standard for body sculpting is still liposuction. We also perform routinely eye lift surgeries, neck lifts, and chin implants. We have any laser that one would probably want to use, including the resurfacing lasers, the pigmented lesion lasers, the skin tightening lasers, hair removal lasers, and vascular lasers.
When you're first diagnosed with skin cancer and told that you need Mohs surgery, it's frightening, especially when that Mohs surgery is done on your face. You're worried about how you're going to look, what's the scar going to look like. But after meeting Dr. Khorasani, it's like a weight is lifted off your shoulders, because you know when you meet him, you're in good hands and you're at the right place, and everything's just going to be okay, which it was.
So after patients have their cancer removed, micrographic surgery, they're often left with defects on very cosmetically crucial areas of the face, such as the nose, the eyelids, and the ears. These areas are very important psychologically to patients as they are so visible in front of the mirror. The second one was a little challenging, wasn't it?
Yes.
It was more on the tip of your nose. And a neat thing that we did about that was that we used your eyelid skin.
Correct. I actually had an eye lift done because he needed to take the skin from the top of my eyelids for a skin graft to fix the Mohs surgery that I had done.
Is there anything that now retrospectively, if you had to tell a patient that never had Mohs before or a nasal reconstruction, one thing you would tell them, what would you say?
Not to be frightened. It sounds worse than it is.
It's extremely important to me to be accessible to my patients. I usually get back to patients within a few hours after they email me. After the big procedure, I tend to always call them to make sure they're okay, and that just one phone call really makes a huge difference.
I think when I was told I had squamous cell cancer on my nose, I thought, okay, it'll be a couple of swipes and I'll be out of there.
We did a deeper biopsy. We saw that there was tumor underneath, so we didn't give up. And after that, you had 8 stages, correct?
Yeah. Yeah. Can you even imagine?
And then after that, then we'll did the reconstruction.
No matter how bad it got, he just kept saying, it's going to be okay. He patted my head. He said, don't you worry, we're going to take care of you. And he did. He did. That very day, I mean, of course, I had a long road to go, and I still have a ways to go. And I know you suggested dermabrasion.
Mm-hmm. So what the dermabrasion would do is to make it, the flap skin kind of melt. Or
then it won't have that little thing-a-do.
It would kind of blend in with the rest of the texture of the rest of the nose.
I saw one of my doctor friends tonight. He said, oh, Dory, hi, how are you? Didn't you have surgery? Oh my God, you did it, I can see it, but oh, it's amazing. I mean, wow, I had no idea that it's only been a short while, and it looks so fantastic.
Channel 7 Eyewitness News.
There are other causes of skin cancer besides the sun. Dr. Hooman Khorasani is chief of dermatology surgery at Mount Sinai Hospital. He's seen an increase in sun-related skin cancers.
Melanoma cases are still very much on the rise.
Dr. Hooman Khorasani is co-founder of the Melanoma Institute at Mount Sinai Hospital. He says the number of melanoma cases keeps going up.
Dr. Khorasani took an older woman and made me young again.
People tell me that I look better, I look more refreshed. They don't know exactly what happened, but that maybe I've been on vacation.
Dr. Khorasani saved more than my life, my physical life. He saved my very being. He's a magician. He's my hero.